In a gathering of 2 or more people, when a lighted cigarette is placed in an ashtray, the smoke will float into the face of the non-smoker. Well, eventually will actually evaporate, and therefore in June 2012, Act 581 here in Ghana was passed to make it illegal to smoke in public. But has anyone been prosecuted yet? We haven't heard of that so far. People live in respecting this very regulation, and we're discussing this because we have in the studio an important personality who also is going to help us do all the discussions. And we have Isa Ali, Executive Director for Vision for Alternative Development, and we're discussing the No Tobacco Day fell on yesterday. That is May 31, 2015. Actually falls on that very day. And it is just a day set aside not only by the UN but also the World Health Organization to make sure that they highlight the concerns about the illicit trade of tobacco, but also the concerns about the health effects and ultimately the destruction to lives and property ultimately. And so we're here to do all that. Ms. Ali, how are you? Your organization, basically, what do you do?
Yeah, that's Vision for Alternative Development. We are into health promotion, governance, and also promotion of safety, both on the road and also domestically. And also we support community participation in governance and development. Gender empowerment is also a cross-cutting in all our projects.
We're privileged to have you in the studio. But for us, when it comes to tobacco and its subsequent effects on the human body, but also the livelihoods of communities, it's about its impact on the health of people, but also the long-term impact on incomes and the livelihoods of other people. Ghana subsequently will say the passage of the law is important, but internationally, what is more critical?
Thank you very much for having me. You know, somewhere along the line, scientifically, it has been proven that the use of tobacco actually is very injurious, and some of the related diseases includes the heart cancer, cancer of the lung, infertility, and even it affects the environment. So along the line, the World Health Assembly decided and actually approved the Framework Convention on Tobacco Control to ensure that at least tobacco-related diseases are reduced. And if we talk about the available data, indicates that currently about 6 million people die of tobacco-related diseases. And it is projected that this figure is expected to increase to 8 to 9 million by 2030. And the sad aspect is that 600,000 who will be dying are non-smokers. That means the passive smokers, those who have not decided to use their money and buy tobacco product, are indirectly inhaling the second-hand smoke, and they are dying, and we need to protect them. So that's why after the ratification of the FCTC by Ghana, the government moved ahead to also enact the Public Health Act, which has the tobacco control measures as the part 6 of it.
Which is the 581?
Yes, at 585 of 2012. So along the line, we are still working around to get the necessary legislative instrument to operationalize some aspect of the law. And then we believe, even if we go back, one, scaring aspect has to do with the available data relating to the youth. And the Ghana Health Service, Ministry of Health, conducted a survey recently under the Global Youth Tobacco Survey, which indicates that around 4.6 of our JHS students are into smoking. And if you move it to the global statistics, globally 12% of adolescent boys are actively smoking, as against 7% of adolescent girls into smoking. So you can see the difference. Even the girls too are now catching up into smoking. And this is very serious. We cannot grow an economy. We cannot grow a country with smokers. What happens to the to the death? What is going to happen with the absenteeism? You cannot develop an economy.
Now, as far as the surveys are also related, the latest we have, and also related to that, is that under 10% of women or females in Ghana smoke. Now, if that is a concern for you, ultimately we know that in the northern sector of the country, we have the growing number of young smokers in that area. What could be attributed to that?
Yes, that statistics actually is not related to only the women. That is according to the 2008 National Health Demographic Survey indicates that 10% of adults, that is, this is national data, are into smoking. You realize that out of this, the 3 northern regions recorded the high number of prevalence. And this is actually challenging. There are so many factors into this. And you realize that in the northern sector, some grow tobacco at their backyard. You know, tobacco is more or less regarded as a traditional product over there. You know, even you realize in the olden days, the old men use the pipes, you know, to do it. So, I mean, it is considered
to smoke raw tobacco.
I mean, yeah, raw tobacco. They think it's normal, and not all.
So almost like part of the customs and practices.
Yes. So, but it's I mean, a practice that must be stopped because it is killing.
Well, we'll talk about that, Isa, because we know that thousands of taxi drivers in Ghana had also given the ultimatum to government that they will embark on a demonstration today to register their protest over what they term the unfair treatment by the DVLA, that's the Driver and Vehicle Licensing Authority. This follows activities of the DVLA they claim is frustrating their business. It's also only because it has been a directive to only register commercial vehicles with seat belts, and they believe that will also collapse their business. And according to the DVLA, the new directive is in conformity with Section 119 of the Road Traffic Regulation 2180, which will also help achieve a 50% reduction in deaths and serious injuries. And so those are what we have. But we know that taxi drivers are also demonstrating currently. And we now take you to close to Ashaiman community, close to Tema, as well as in Sakumono, that the taxi drivers have also, well, blocked roads there just because of the latest protests against the DVLA. We have on the line Matilda Apamega. Very good morning to you, Matilda. What really is going on there?
Exactly. It's not even about taxi drivers. I think it's all the drivers here in Ashaiman.
Why are they demonstrating, Matilda? Matilda? Well, we seem to have lost Matilda on the line. But those are the pictures. Again, we'll flip through those pictures for you. And this is the Ashaiman station. The drivers... The drivers are waiting. The passengers are also still in queue. They're hoping that they can get the commercial vehicles to catch them to their various destinations. I'm sure places of work or destination points where they can get access to some other vehicles in Accra or subsequent areas to get to work, and very much remain stranded, as you can see in the picture. We'll flip through those pictures once again, and we'll speak to one of our lead reporters also on the line. Okay, so we have Emma Fairley, and she will be online soon. And when she's on stream, we'll try and get to her and ask her. And well, I've been told she's on the line. Emma, a very good morning to you. Where are you, and which part of Ashaiman are you, and what really is happening? Is it the same situation as was earlier on being reported by Matilda?
Yeah, good morning, Roland. Somewhere Ashaiman Middle is the area just close to the motorway. I had to go through this route because the whole access, all the access routes linked to the motorway through Ashaiman have been blocked by these commercial drivers. And they are so agitated. The police is moving in. Because of that, it's not just the passengers and the drivers themselves. Private vehicle owners are also stranded. As it stands, nobody can go, nobody can come in. So most drivers are still moving up and down, looking for alternative routes to be able to get out of Ashaiman. That's the situation. And I'm a victim as I'm speaking to you now. I can't get access to the motorway. I'm stuck in the heavy traffic around the pylon poles close to the motorway at Middle East. That's the situation now.
So you're almost a reporter now, but you're also a victim. Well, we'll want to place you in the first category, a reporter, so that helps us. And we know MFI is one of our lead producers here. But MFI, what really may be the reason why the drivers are demonstrating?
They are protesting the directive by the DVLA to enforce the installation of seat belts in their vehicles and renew their number plates. I don't know much about the renewal, but then I'm wondering why the DVLA will be coming at them this very moment to ensure that they do that regularly. But that's the situation for them. They think that the decision is not in their favor, and the fact that every day they meet the police on their way and they collect money from them every now and then. So they want to ask what is happening. That is the problem now. And the seatbelt, they go like, the vehicles they are working with have been like that for as long as they've been working with it. So why would the DVLA just all of a sudden come at them and be insisting that they immediately install seat belts in their vehicles before they continue their operations? That is what they are protesting.
But you do know that the DVLA had early on gave this very announcement about the ultimatum for ultimately giving this very directive for the drivers to fix the seat belt, and they had been going through a number of trainings, etc. You do know about that. Have you been able to interact with them and ask them whether the communication has come forthwith or foremost from the DVLA?
I'm unable to interact with them because I'm in my like I said, I'm trying on my own to get to the office. Not in their vehicles. I have my own means of transport, so I wouldn't use their normal routes where you have these drivers flying.
But you are stranded.
Sorry?
But you are stranded.
Yes, I am. Like I told you earlier, I'm stuck in heavy traffic around Middle East. The traffic is not moving. It's not moving.
Okay. Well, thank you very much, MFI Eli Atiamwa, and well, she is currently stranded, but because she's also one of our lead producers here, and so has the capacity to give us all the reports. And so our lead reporter there this morning on that very subject, Matilda Pemagan, is also monitoring issues, but Kwete Nate is also monitoring the issue on the main stretch, Tema Accra motorway, and he's on the line. Where are you currently on that very stretch, Kwete Nate?
I'm currently standing at the Tema motorway roundabout that adjoins Tema and Ashaiman.
Now, for what reason, apart from what they gave you, the drivers have given you about the seatbelt, are they also picketing or even protesting or blocking roads?
Yes, the Tema Accra motorway was blocked. So currently there is an armored vehicle, then about dozens of police officers who are still standing at the particular spot the drivers blocked. And if I should give you a picture of how choked the traffic is, it's like a 15-minute walk. I just completed my journey from the motorway overhead to the intersection here. So it's like a 15-minute walk, and that's how choked the traffic situation is.
And how are the police helping, especially now you're telling us that they have a station armored car there to reduce the current traffic, but also be in a dialogue position with the leadership of the drivers?
Not necessarily. What the police are doing currently is managing the traffic, because their presence have more or less, deterred the drivers from blocking the road. So they've cleared the road of the blocks, ties, and tree stumps that have been used to block the road. So they are still standing there to ensure that there is free flow of vehicles.
Well, Kwete Nate, we'll have to let you go. But before we go, though, have you been able to interact with the police, and have they confirmed whether the activities of the drivers this morning is basically illegal or just well in their rights to protest or picket?
That is something I haven't cross-checked yet.
All right, so we'll leave you to that and try and find out a lot more for us. Kwete Nate. And so we've had a string of reports this morning, and MFA Eli Atiamwa has been giving us the latest report. Matilda Pemagan is also monitoring issues also from that area related to concerns raised by drivers over a directive by the DVLA that they needed to fix seatbelts before even there were renewals or roadworthy and also licenses of operators of various commercial vehicles. And we're told that that could also lead to various taxi drivers and other operators of commercial vehicles to also be protesting somewhat about the current directive from the DVLA. We'll get back on that in, not only on this very program, but subsequently on various news programs on this very channel. But let's continue our discussions on the No Tobacco Day that was marked or is being marked by the World Health Organization and other UN-related bodies on the subject of its effect on people's health. Issa Ali is still here with me, and you were talking about the effect and subsequently about how the adoption of the practice in itself, especially in northern part of Ghana, is a prevalent statistics that is also related to other countries.
Yeah, so if we look at the statistics, indicates that the three northern regions actually are highly in terms of smoking. And as indicated earlier, this is as a result of some cultural practices which has been handed down to them, but it's very deadly, and a lot is ongoing to ensure that they are sensitized and to make sure at least the youth and other, the women are not highly addictive. And it's very sad actually to see that, non-smokers are inhaling tobacco smoke. Even as far much as 600,000 will be dying as a result, of not days. Imagine a father, smoking in the presence of his children. Imagine smoking in the presence of pregnant woman. So you realize that there are so many practices that are ongoing and they are very injurious to women, and even it's not gender, good to our women and children, and a lot needs to be done. And this brings us to the aspect of the illicit trade and smuggling, which
is the focus of the No Tobacco Day
this year.
Now, as we focus on that, how is the persuasion of the social marketing aspect or communication level of educating the communities and the households that it is bad for you continuously to be adopting the practice in itself, but also those who have who have adopted the practice don't turn also to make people passive smokers?
Thank you. As you know, we now have the law, and which was developed out of the international convention. And normally, we don't believe that as far as there is a law, people should be punished. We should go on punishing people. Now, sensitization is ongoing, especially among the regulators. The custom officials are being sensitized. Medical students are being sensitized. Nurses are being sensitized. And we believe even community leaders, assembly members are being sensitized. We believe that if we are able to sensitize the core, the stakeholders within the country and communities, it will go down. Even you realize somewhere last 2 years, or 2013, the World No Tobacco Day was celebrated actually in the Brong-Ahafo region in Sunyani. So we are hoping that, and even was it 5 or 6 years ago, there was also celebration within the northern region. So we are rotating the celebration to ensure that the public, is aware of the dangers of tobacco smoking. And we know that, yes, nicotine is addictive, and nicotine is one of the key ingredients in tobacco products that whenever you smoke, it makes you addictive. So we believe that as we continue educating the public, which, we still have structures in place. The Food and Drugs Board zonal offices are working around the northern region throughout Ghana, and also the Health Promotion Department and Disease Control are also working. And VALD and its allies within the Ghana Coalition of NGOs in Health are also working to ensure that within a short time, we should be able to educate people for them to consider tobacco as a bad product. It's already a bad product. So we believe that within a short time, we should be able to address these challenges in terms of the acceptability.
Now let's focus on what the attention or the theme of this year's No Tobacco Day is: illicit trading. We know that, well, we have a tax barrier of even 150%, but how come do we still have tobacco-related products in the country?
Thank you, Roland, for this question. Actually, it's unfortunate that within the middle-income countries, hardly do we see data, or do we have, reliable data. But if we get back to even within the European region, EU actually reported that they are losing 10 billion euros a year as a result of illicit smuggling and also tax losses. Even imagine, even out of the tobacco that they are able to seize, 65 are counterfeit. We are talking about a developed society. a region with high level of technology are even facing challenges dealing with illicit trade. What happens is that illicit trade is being practiced, or smuggling, we can categorize it into three. We have individuals engaged in that illicit production, manufacturing and distribution. We also have groups engaged in it. Normally what they do is that they engage in this. Even terrorists and other groups are also engaged in it. And sadly, the tobacco industry themselves are into smuggling. They do that because we don't have a good regime of track and tracing. For instance, a product that has been manufactured at a manufacturing plant, let's say from Nigeria or Senegal, we don't have the technology or the risk or the facility to trace it from the production level up to the consumer. So there are studies well accepted globally that the industry itself also promotes into smuggling. It's also a challenge.
Well, just be there. I'll just go to this place and ask whether you try to give us a lot more of the understanding. Now, we have this very statistics that give the indication that as far as we're concerned, we have young men who drink or smoke, and we have Paraguay, and studies were conducted way back over the last decade and 2 years in addition. We have Kenya, we have Ghana, and then we have China, etc. We know that in China, for example, Lisa, what they're doing is currently making sure that, well, they try to ban smoking in public and even private places, so to speak. They tried to implement that when they had the Olympic Games, the Beijing Olympic Games. That was successful within the period, but since then they haven't been successful. What really is the statistics currently as to how we're doing in the adoption of the practice or not in Ghana?
Yeah, in the issue of the China, what we're experiencing is that, you know, we have a tobacco company owned by governments. So the government of China are actually involved in tobacco production. What they are now doing is that they are now trying to regulate and reduce the usage by their citizens whilst trying to open a new trade route into Africa and other developing countries, so that they will be able to protect their citizens, but the citizens of other countries to engage in there. So if we look at the statistics, as I indicated, the estimation previously was that before even the implementation of the Framework Convention on Tobacco Control, we realized that at least the projection was that by 2030, we should expect 10 million deaths. But with the good regime, good legal system in the developed countries, the statistics has reduced to 8 million. But the worrying aspect is that how come that within the developed countries where tobacco is being manufactured, where the shareholders are, they have a stronger legal regime to control tobacco. You cannot smoke anyhow as they used to do now. Now they just land at the airport, they start smoking. You cannot go there. Even in terms of the aspect of the youth, you can see the data. You can see. You realize that even in India, you can see the high prevalence because of the population. You know, countries like Uruguay. You know, over there, you compare the population as against their legislations. So we believe that if they are able to protect their young ones, at least Ghana we should be able to implement and make sure that.
But would you say, as far as smoking is concerned, we're looking at all these statistics that we have around Paraguay, Brazil, Kenya, Ghana, China, India. Would you say that, well, as far as the prevalence is concerned, compared to those countries, we have, huge number of smokers than we have in our country?
Yes, it's right. You realize that some of these countries, if you take, for instance, Brazil has been, if you look at the population, they've been, the citizens have been smoking long ago. You understand me? It has become like a culture, part of them. Even if you go to India, even apart from the normal tobacco, in India they have something called bidi. That one too is another form of tobacco product.
So, some kind of a substance that you take that makes you high.
Yeah, it's a leaf, they put it under their tongue and other things. It's like what we are now experiencing, the shisha, which is being
It's got some narcotic effects?
There are nicotines in there. And the sad aspect is that people assume that because it doesn't emit smoke, so it's normal. It's not normal. And those countries, I mean, the developed countries have now reached the peak. I mean, they are not able to address the aspect of cancers being caused by tobacco smoke. There was a study in Italy which indicates that 92% of oral cancers within the country is being, I mean, caused by tobacco smoke.
And if you take oral cancer, you're talking about the gums and other related areas within the mouth.
92 are being caused by tobacco product. So we believe that a lot needs to be done.
It's good that you mentioned shisha, because, well, you see it among, so to speak, celebrities and top personalities, and especially when you go to the top Arabic countries, you get to see that it's something that is ongoing. Is it dangerous or not? Or is it a prevalence act or habit that leads ultimately to smoking?
Shisha is the worst thing to have happened to Ghana. Now, if you go to parties, if you go to, I mean, event, you see our young ones, I mean, using shisha. Normally, the sad situation is that if you puff one, it's equivalent to 20 sticks of cigarettes.
Okay. Well, we're opening the phone lines, and so very soon we'll be having displayed on your screens the numbers for you to call. Well, this is what we want you to do. If you know you're a smoker, please call in, share your experiences with us. If you have a friend who smokes, or your friends who smoke, or you always move with a group of people who smoke, please share your experience with us. But also, if you don't want to smoke, give us your reasons and why you think smoking is bad and why you think that a lot more young people need not to be smoking. And so these are the numbers: 030221169 102. And so the number is there, so just make sure that you call that very number, and let's get interactive as always. Please share your experiences with us. Now, if you go to perhaps countries where they don't take alcohol, where alcohol is not usually encouraged, smoking is always the in thing. How do we make sure that for a habit that we want to kick out, what we see in films and what the media portrays doesn't become a kick-starting habit for young people who tend to think is a subculture, so to speak? Yeah,
this has to do with communication and acceptability. You know, knowing that nicotine is addictive, and it needs, I mean, the smoker needs time, you know, to be supported to reduce the habit. So there are facilities within the country, the psychiatric, the the polyclinics are there, the psychiatric unit to help. But you realize that, yes, it's interesting to note that even in our country, the young ones, they still smoke, at the same time they drink. So the challenge is that we realize that there are so many studies. I read a publication from the Narcotic Control Board which indicates that the use of tobacco is the gateway to the use of other drugs.
We have on the line Mahama from Tema, and tell us your experiences. Are you a smoker, or you have friends who smoke?
No, but I have a friend who is smoking.
He smokes what, cigarettes, or he smokes tobacco or weed?
It's cigarettes,
okay.
But you know, cigarettes are tobacco products. But what I wanted to contribute is that when the gentleman who is speaking, nowadays we talked of shisha, but people are also engaging snuff. Yes. And I don't know the advice that is given to the public. Because if you look at now, the young guys are now taking snuff.
Well, thank you very much, Mahama. Mahama is calling us from Tema. And he raised an issue that shisha may be a concern for us, because even the pipes are being sold in the malls, etc. currently now. But snuffing, it's something that people, because there's no smoke coming out, think that is normal.
Yeah, you know, tobacco products, we have two types. We have the smokeless, and we have the one emitting smoke. You realize that I want to advise Ghanaians to actually look under the container. Normally, you see our old men using it, you know, sniffing. They say, oh, normally they do it to cure headache or so. It is a tobacco product. It's injurious, deadly, as the same as with the
Barnabas, you're calling us from Bibiani. Barnabas.
Yes, sir.
I hear you smoke. So why do you smoke?
I don't smoke. I have never smoked.
Okay.
Before.
Do you have friends who smoke?
Well, I have moved with smokers before. But I know there are 3 types of smoke, those that I know of, according to my level of understanding. I know of the snuff and then the cigarette. And my father used to chew tobacco. He died at 95. Is that how is that dangerous to? I mean, the chewing of the tobacco. How is that dangerous to people? Because I know I'm from the north, and I know a lot of old people chew tobacco. They are very old. You know, some of them die crossing the century age. You know. I
know that very habit. You know, well, your parents may have indulged in a habit, and because they stayed long, you think that is also good. But we have also calling us from Goso is Vitals. Vitals, let's take your call, and then we'll make Ali make some interjections here.
Good morning.
Morning, Vitals.
I have a brother. Like, I want to ask a question.
Please
do. The youth of nowadays have the addiction of smoking cigarettes.
Please do. Go ahead, sir.
I have a brother who has been addicted into this smoking all the time, that had a stroke some time ago. And now, though, like, they've given him so many medicines, but it seems like he is not willing to stop. And then, like, the medicine that they also give to him is not actually helping him out.
So you want to see how related that is?
Yes.
Okay, thank you very much, and that's from Vital. So answer the first one. The first one, he's seen a generational evidence that seems to say, well, the daddy smoked and still lived for a very long time.
Yeah, Roland.
And the second one is about somebody who is
Roland,
in a dilemma.
One thing that we should consider is that we all have different immune systems. Some have a strong immune system that can stand the test of time. Others have weak immune system. I'll be glad if he will be able to call back and tell us what happens to the teeth of his father, the gums and those
so
things.
Even though you are saying that even though he may be living, he may have lived long,
but some are living
there are still some physical effects.
Yeah, some are living 120, 130. He can still live longer. But the fact that he lives up to 95 does not mean that, he's okay. I'll be happy if he can.
And the second one?
Yeah, the second one, the second question has to do with if you remind me.
No, it's about having his brother who smoked and ultimately had stroke. Now they're trying to give him the medications, and he's still smoking, and the medication also still seem not to be working.
Yes, what I will advise is that, one, if you've been smoking for a longer period of time, actually what happens is that you have lung infections, and it goes in to affect even the blood vessels. The blood cannot flow. That's why it's been linked to heart diseases. If the blood cannot flow as it used to do, then you should know what is going to happen. And one challenge, scary aspect is that immediately you smoking, within 7 seconds, the nicotine gets into the brain and start giving you a sensational things. It causes not only even stroke, even infertility.
Okay, but ultimately education is the key, you're saying.
You should consult the doctor.
We have Amadou from Bedua, and thanks for joining us. Share your experiences with us. If you have any questions, so please ask.
Amadou Aziz is my name, calling from Bedua.
Okay, Amadou. Please go ahead.
Please, I do have an uncle who can smoke about 1 pack of cigarette between 1 to 2 hours. This man tried to control it, but up till now we can't get over it. So they are asking to hear my advice to my uncle.
Well, thank you very much, Amadou. It just shows that he's addicted.
Very much addicted. So I will advise that you consult a doctor or the psychiatric unit within the polyclinics and even across psychiatric hospital. Facilities are there to help those who want to, because we have in our law, there's a provision that mandates government to support those who wants to quit. Even, let's talk about even the financial loss is big. Imagine if it takes 2 packs, imagine, multiply it within a day. Even some take like 3 packs a day. Multiply it by 7 days. 7 days. 30 days. Multiply. It's a lot of money being lost, which we believe that this money could be used to support the family. I mean, is challenging, which we hope that at least government will have to do a lot. And also, it's about behavior, you know. We need to educate the people much, to give them the information before they come.
Well, we're privileged to have Barnabas back on the line. Barnabas, you're back on the line.
Very interestingly, my daddy died at 95, yet his dental formula was still intact. That is
He didn't chew cola nuts?
He chewed cola somehow.
And the teeth was still white? Are you sure?
Come again?
Are you sure his teeth was still white?
No, for that one day, in fact, it wasn't. Yes.
Right.
I know the time that I saw this man week was the year that he died. You see, he died at the time he got weak. That was the only time I saw that he was sick. But
do you smoke, Barnabas?
I don't smoke.
Do you have any of your siblings who perhaps may have adopted the habit from your dad?
Never.
All right. But do you think smoking is bad?
It's very bad, I know. And in fact, the most dangerous one of them is the snuff, which is gaining root among the youth.
All right. Do you know about what they call shisha?
That is one thing I don't know. I'm just hearing it from you. And in fact, if you can tell me,
sometimes you watch a number of the clips from the Middle Eastern countries, and they have these pipes. No, not necessarily movies. It could be documentaries or whatever. Not necessarily movies. You see, they have these pipes. They have a jar that hot or steaming water is boiling from, and they put it in the mouth and they try to inhale the smoke or take the steam, so to speak. Have you seen that before?
I have seen that one.
Right, so that's called shisha. Shisha. I think a player of the Black Stars has
a lot of young guys die here in the DNA from this snuff thing. And in fact, it's very dangerous. I have tried to educate some of them, yet, you know, some of us, we are not influencers, so if you tell them, they feel you are making money. So if the campaign
who determines who is influential, Barnabas?
Oh, at least some of you are very influential because we are on the ground.
Well, thank you very much. Yeah, thank you too. We wish you well, Barnabas, and I hope that you also continue the education that smoking really is not a good thing, but ultimately is to make sure that we have less of the product in our markets.
Yes, that's the challenging, because whilst a lot is being done by government to counter illicit trade and educate, you realize that a lot are into smuggling. Somewhere to 2010, VAL conducted a survey. Actually, it is scary. What we realized was that normally the traders will display the so-called the regular ones, those imported, I mean officially imported, are there well displayed. Then if you want to buy, then you will see that they will remove other ones down there.
You mean different brands?
Different brand without warning signs, without inscription. Then we realize that those are the smuggled ones. So they exist. I mean, if you go within the northern region, within the metropolis, I mean, it's there. It's a big business that is happening. So we want to believe that, yes, if the tobacco industry is into it, they should try as much as possible. So we are very glad that as a result of the smuggling, the world has come together to adopt the illicit tobacco protocol, which you hope within the short period the government through the parliament will ratify it and make sure that at least Ghana is free. Because the more we have tobacco in the product, the more, I mean, we lose our young people and the children, which is very injurious to us.
Well, thank you very much. And we have had in the studio Isa Ali. He is Executive Director for Vision for Alternative Development. We've been talking about the illicit trading of tobacco, as that is the focus of the theme for No Tobacco Day that was marked by the WHO on May 31, 2015. And we hope that the lessons have gone into the ears of many people who would have been watching us this morning. Always make sure you get interactive. We have on Facebook, Join Us on TV, and also a handle on Twitter, Join Us on TV. Thanks for joining me, Isa.
You're welcome.
All right, so we're taking a break. When we come back, we're speaking on the subject of poetry, and there's a festival coming up. Why do we have a lot more poets these days trying to speak about the ills of society and try to mirror whatever concerns they have of our society? So do stay on. We'll have a lot more for you.